With the nation on pause, it's not surprising that a new survey found 91% of Americans are concerned about the economy, right? Well, 52% are concerned about their employment status. This real-time data was compiled to study how deep of an impact the pandemic is having on our mental health. So here at the findings and some solutions is Dr. Anthony Hassan, President and CEO of the Nguyen Veterans Network. They operate 15 mental health clinics nationwide. Thank you, Doctor, for joining us. I think the first thing I want to ask you, though, is many of us have been home from, 4 to 6 weeks now. What should we be feeling, and how can we just make sure that our mental health is in check?
Oh, absolutely. We all should be feeling anxious. This is a tough time for us. We're living in this turbulent time. The coronavirus is threatening our way of life, our family, our health, our family and friends. Yet there's great concern. 72% of Americans are struggling with basic necessities like employment, finances. Things are tough. And many have lost their jobs. Kids are at home. They're cramped into an apartment. This is a tough time for so many families. And so, yeah, negative coping behaviors come out of this. I'm worried about things like child abuse and domestic violence and even suicide. This is a tough time for every one of us, and we're all going through it together. And it's not going to get better anytime soon.
We're hearing numbers of abuse, whether it comes to child abuse, spousal abuse, are up. So how do you combat that if you are having to self-isolate with perhaps an abuser?
It's so tough, right? It's really hard to do, but there is help out there, and you can reach out to these emergency crisis lines and get the help you need. We need to learn how to manage our life, and sometimes it's difficult when we're in these kind of relationships. It doesn't make it easier, but certainly if you're feeling threatened, if you are being threatened, you should call 911 and get help. There is help available, and there are places to go. This is really a scary time for everyone, especially if you're in these types of relationships.
Absolutely. Yeah, and according to your survey, 70% of Americans are really worried about their physical health due to COVID-19. 58% of Americans are concerned about their mental health because of social distancing. So when we look at those numbers, what kind of advice do you have for people who are self-isolating and trying to cope with all of this?
Yeah, so it's really tough, but my first advice is always to take care of yourself. Focus on what works for you. We always talk about just eat, just sleep, and exercise. Well, that doesn't work for everybody. Life is complicated. We have kids under tow now, and it's important for us to find that routine for ourselves to be able to reach out and not isolate. Find someone that we can talk to, a clergy member, a friend, someone who makes us smile. Certainly exercise helps, but if you're stuck in an apartment, what can you do? Well, you can run in place, you can do a YouTube exercise video. We have to take time out. Go to your room, shut the door, listen to some music, something soothing, a meditation, something that makes you smile. It's really hard right now, but if you reach out and you ask for help, you talk to someone, you don't isolate, things can get better for you over time. But remember, nothing will change unless we do something different.
Absolutely, and I understand some free help is out there. Can you give us a list of where people can go or some information on that free help?
Oh, absolutely. You can go call a hotline. There's hotlines all over. You can just Google search hotlines for domestic violence, suicide hotlines, peer support hotlines. There are places around the corner. Your community mental health center is still seeing patients. There's the Cohen Veterans Network if you're a veteran. We're doing telehealth. Telehealth has made care accessible to all now. So you can have a Zoom session or FaceTime just like this with a therapist. Look, therapy works. Counseling works. Talking to clergy works.
Absolutely. So keep talking, reach out when you can, and know that there's free help out there as well. Dr. Hassan, thank you for breaking it down. We appreciate the information in your survey and your information this morning.
Thank you so much for having me.